Very excited to present the Community Service Award. This is going to go to Olmsted Housing Stability Team. This award is given for non-physicians who have shown outstanding leadership and quantifiable results in elevating the general health of the community. Olmsted County Housing Stability Team, I just want to thank you for your service. We've been working so closely with you in the past couple of years as part of our street medicine initiative. We are grateful for Olmsted County Housing Stability Team's outstanding collaboration with ZVMS and street medicine to help us build those necessary relationships with individuals we serve. You help in providing housing and social service information to individuals experiencing homelessness and educating CVMS members on issues affecting unsheltered individuals. We just thank you so very much for the care that you provide for our unhoused neighbors and for the partnerships with ZVMS Street Medicine Initiative.
Well, thank you, Dr. Kingsley. I thought I would just share a little bit about the Housing Stability Team and introduce the team members. The Housing Stability Team is part of the Olmsted County Housing Department. We are just one team within the Housing Department. So our team, including me, we have 8 members on the team. Stephanie Foster is our housing specialist. She does a lot of the work behind the scenes and determining rental assistance for some of the programs that we offer. Bill Franken is a housing resource coordinator who oversees our housing support programs and some of our smaller rental assistance programs. Trent Flugel is a housing resource coordinator and he does outreach. He's primarily housed at our Echo Center. Jake Radke is also an outreach worker and is housed at our Echo Center. Heidi DeHutt is our outreach worker and she's also the case manager at our 105 permanent supportive housing building. Lisa Roving, she is our case manager at the Francis, which is permanent supportive housing, and she also does outreach. And then Shelley Glover is also part of our outreach team, and she is case manager for a rental assistance program we have called SHORE, and she also spends a great deal of time at ECHO. Just a little bit of history of our team. The Housing Stability Team was created actually in February of 2020. And there were 4 of us on the team at the time. And it was created without a well-developed plan. So in all honesty, I went into it wondering, how am I going to spend my time? But then COVID hit literally a month later, if not just 3 weeks. And we really immersed ourselves in the direct service of trying to get people housed who were unsheltered or who were using sheltered. And we really had a great deal of success with that during that time. I hate to say it in this audience or with this audience, but the pandemic was really kind of a blessing in disguise for us. It was a true opportunity to really embrace the partnerships. During that time, we had to work together to really get through COVID. And we've been able to sustain those partnerships ever since and actually develop some new ones, including what we have with Zumbro Valley Medical Society. I saw that Dr. McCoy is on the call and we partnered very early on with community paramedicine. They provided medical support to our COVID isolation space for people experiencing homelessness. So that was just a great partnership early on. Since then, our team is now doubled in size. We are now 8 people strong, and we're adding 2 more social workers at the end of February to actually work with families and youth who are experiencing homelessness. So that is an area that we haven't touched on a whole lot, but we certainly intend to now. A couple of other just successes since our team came together. We created the Creek, which is an extended shelter program, the 105, which is permanent supportive housing, and then of course the Echo Center, which is a drop-in resource center for anybody experiencing some housing instability or homelessness to get connected with resources. And then of course, with the addition of the team members, we've been able to expand our outreach. And part of that has been just this great partnership with Zumbro Valley Medical Society, street medicine with Dr. Hyde and Dr. Kingsley, and the medical students. I've been so impressed with just the grassroots effort around street medicine and the passion that the students have for this. So that's just been wonderful to see. So we are really fortunate to have this. And with recuperative care on the horizon, I'm really hopeful that, this is just a springboard for where this can all go. We certainly recognize during the pandemic, and of course now as well, that none of this work can be done alone. We must partner to really have an impact and to end homelessness, which we feel strongly that we can do. But it definitely takes all of us to do that. So I'm fortunate to have an incredible team. I'm in awe of the work that they do and the passion that they have and the compassion they have for people experiencing homelessness. So I just appreciate the recognition, and I know the team does as well. We're really grateful for this. So thank you, Dr. Kingsley and Zumbro Valley Medical Society.